I'm Dr. Melody Chong, a podiatrist. I treat ankle, foot, and some leg issues. And I'm located at 3838 California Street. And I've been in practice over 25 years. So diabetic socks, they're loose-fitting socks and they don't bind. So they're not tight, they prevent skin irritation, and they also provide protection. For the most part, they pull moisture away from the feet so that sweat can evaporate so that there's less risk of getting a fungus infection. Also, they can prevent smells or odors. Hence, they allow for the feet to be drier. They usually are seamless. So not having seams along the toes and the tops of the socks prevent rubbing and blisters. And the concern about blisters and rubbing is that you can get open wounds and ulcers. And these are things you don't want to get if you have what we call neuropathy or no feeling in the feet, or if you have high blood pressure. The other good thing about diabetic socks is that they're made out of soft kind of yarns. Often they're made out of bamboo and wool kind of yarns. And these kind of materials are antimicrobial, so they prevent infections, and they also are not harsh on the skin, and they don't cause friction, which again can lead to rubbing and blisters and open wounds and ulcers. The other advantage of diabetic socks are that they usually stay up without squeezing the calves or causing decrease of the blood to flow. So that's important too. And another feature of diabetic socks, in addition to being antimicrobial, they're antifungal. So that means they have the ability of preventing infection and fungus or athlete's foot in the skin and in the toenails. And these are the kind of properties in this kind of sock. They usually have silver or copper, which are both antimicrobial and antifungal. Another feature of diabetic socks are that they have padding. They have extra padding, usually on the pads of the feet and the soles of the feet. And this alone can stop injuries from occurring. So they're protective as well. So in general, I do recommend them. There's a lot of features that I just went over that are very helpful. They keep moisture out of the feet. They don't have seams. They're made of soft yarns, and they stay up without falling down. Another good feature of diabetic socks is that they're usually white color, so that if you see any drainage of wounds, that is helpful because often diabetics can't feel any wounds or openings in the feet. So just being able to see blood on the socks is helpful so that you know to go to a doctor for treatment. And again, they're antimicrobial, antifungal, and they have padding. So those are the pluses of wearing them, and I do highly recommend them for diabetics, whether you're pre-diabetic or you have full-blown diabetes. Oh, that's a good question. No, they're readily available at stores, medical supply stores, on the internet, of course. So you don't need a prescription. And for the most part, if you do have a prescription, it's not going to be covered by insurance. There are two prescription ones. There's one that's been out for years. It's typically covered by insurance, but it typically is not effective at all. I've had patients use it for many years, and then they come to me saying it hasn't worked. I've been putting it on every day, removing it weekly. It's still not worked. What other treatments are there for topical? There is a newer one out that's somewhat effective, but most patients don't use it because it's very, very expensive. It's not covered by insurance. So that can be very, very costly for a patient. It's a few $100. It could be, I think, upward up to $800. So I don't usually prescribe it because it's considered a cosmetic treatment. And so for an option, I do carry an antifungal topical in my office, and it's much less expensive at the podiatrist's office. And so it's been very effective, and that's why I carry it here, and it can only be bought at a podiatrist's office. The advantage is not only does it help, but it has a money-back guarantee through the company. So if you're dissatisfied, you just call them and they will refund you the money. But I haven't had too many issues where the patient's unhappy with it because it's effective. So for the most part, topical treatment is very challenging in that it takes a lot of effort, meaning you have to put it on twice a day. This one, you have to roughen your top of the nails weekly, and then that allows the medication to get in. And sometimes I have patients come in and I can thin out the nail so that it gets in more effectively. Generally, flat feet, very common, bunions, hammer toes, ingrown toenails. That's often hereditary. Gout can be hereditary. Having high arched feet as well as flat feet. Those are the most common hereditary problems that you get from your parents or your grandparents. So that's kind of a tough question because I've had babies that come in with ingrown toenails and they're just born with it during, when they're in their mother's womb. So that's hard to say, but it varies. Also, there's a variable with fungus toenails. Sometimes fungus itself can cause an ingrown, for an example. But for heel pain, that can occur at any age as well. There's a lot of variables, like the kind of shoes you wear, what kind of activities you do. So for example, if you're wearing high heels and your parents had bunions, wearing high heels is gonna make it come out sooner. So you might have it at age 20 versus age 40 or 50 or 60, depending on the type of shoes you've worn when you were younger. Also the activities you do. If you're more active, these kind of things occur more often and sooner. Let's say you're an athlete or you play a lot of sports when you're a teenager because you're active and you're playing sports all the time and your feet are always sweaty. You're more likely to get athlete's foot, but if you take care of it, you might not even have it when you're older. I think more or less, if you're diabetic or something and your parents have that, then you are more likely to inherit that sooner. So for things like diabetes or gout, you're more than likely to develop that at a sooner age than later age. But then on the other hand, if you're prone to getting diabetes because your parents have had it, if you are very good about your diet and watch what you eat and your exercise, you might not get diabetes at all. So it just really depends on each individual. So I think if your nails are normal, meaning they're not really thick or ingrown, then it shouldn't be an issue as long as you cut them straight across for the most part. So just be careful, don't cut them too short because you can also, cut yourself or cause pain. But if they have fungus, meaning they could be thick, they could be ingrown, they could be hard, they could be painful, then you could cause damage. On the other hand, you might not even be able to use a nail nipper because they're so hard and thick, in which case, then you should see a podiatrist because we do take care of those kind of nails. We can help you cut them. We call it debride the nails. So also, if it's an ingrown toenail, I would not use a nail nipper to trim them because I've seen people that really cut themselves and cause an infection. They try to cut out the ingrown. So that's not a good idea. So in those cases, you could do harm. Same with calluses. I've seen patients that use their nail nippers and try to remove calluses with a nail nipper. And so that's a little dangerous too. As patients get older, it's hard for them to see what they're doing down there. So then I recommend you see a podiatrist. And particularly if you're diabetic, I don't recommend you cut the nails or calluses have a podiatrist do it, because of diabetes, they often lose feeling, patient can't reach down, they're in pain. All the above scenarios are things in which you probably should avoid and have a professional podiatrist do it, not a manicurist. Don't go to those nail salons to have the nails cut if you have those kind of toenails. If you have any questions, just feel free to call or schedule an appointment. It's always best to come in person, and I'll be happy to consult with people.
What did you think of the video? Are there any other topics you want our doctors to talk about? Leave your comments or questions below this video. Like and share this video to spread the knowledge. Check out the related videos on screen if you're interested in learning more. Make sure to subscribe and click the bell to get notified whenever a new video is posted. Thank you for watching.